I am Dr. Heather Moore, owner of Total Performance Physical Therapy, and today we are going to go and talk about why do I have pain when I sit for too long. Lots of times around the holidays, traveling picks up, so you're in the car sitting, you're in meetings, and you're stuck sitting, and you sit, and your back is on fire. We get this a lot in here. I just can't sit. I can't sit for more than an hour. And a lot of people don't have the ability, or they don't want to get up and stand up during a meeting. They kind of sit there and they phase out of the meeting because their back is screaming. So what we're going to go through today is kind of why that is and what you can do to fix it and how you can help yourself while, when you're sitting. So what happens is a lot of times it's a good way to tell kind of what's going on in your back is if you start to sit and you sit down and you're totally fine and you're sitting in this meeting and you feel okay, maybe a little bit of twinge, but after a while, like you just start to feel a lot of pain. Usually that's a lot of indication that there's muscle issue going on there. And why do I say that is because what happens is your muscles are just pumps. So if they're not getting blood flow, if you're not moving, I know if you've watched my videos, you see I fidget all day. This is what I do. I move. I very rarely ever sit or stand still. I'm up from my desk all the time, which is why if anybody ever comes and peeks into my office, they yell at me and they're like, oh, your desk isn't ergonomically set up correctly. I don't need it to be. I don't sit for more than 15 minutes at a time usually. I'm up. I'm at the front desk. I'm working on a patient. I'm doing a million different things. So, but I'm doing this because I need to stay loose. My body needs to stay warm. And what happens is as I'm doing this and as I'm fidgeting and I'm rocking back and forth, while it makes people uncomfortable, it actually helps the blood flow go to my muscles. So the blood is constantly being refreshed through my muscles, which is the idea, which is why when you wind up sitting for too long, the muscles stop. The muscles, they seize up. So there's no blood, there's no refreshing supply of blood coming into those muscles to flush any of that garbage out. And the longer you sit, the longer they scream, okay? So while sometimes this can be actually comforting news to people because people who think they have massive back problems, sometimes it's just more of a muscle issue gone awry, that once you start to actually work on it and you get in and we take a look at it, we can start to reverse a lot of the effects of what's going on. But this can become excruciating, and the longer you sit and the longer you don't do anything and the longer you can't move, especially if you're on an airplane or a train or something where you're just confined and you're sitting like this and you can't go anywhere, you really wind up with a back that's screaming by the end. And that's just because there's no blood flow. There's nothing getting to the muscles. So we're going to show you 3 simple things you can do tonight without really anybody knowing you're doing anything. You can be pretty inconspicuous about it. So if you are caught in a big meeting or you're caught somewhere and you can't get up, like an airplane or a train or somewhere where you're confined, this is going to help you loosen up that back a little bit, get some blood flow going. Obviously, the best thing to do is stand up, move around. But if you can't, these 3 things are going to help you move. Now, what you don't want to do is you don't want to wait until your back is on fire to start doing these, because by then it's too late. By then the blood has seized up. It's going to take a big rush of blood to get that garbage out, to get that muscle feeling better. That's why a lot of people will say, you know what, my back feels better if I just walk a little bit. Like that helps my back, just an easy walk, because the blood is flowing in there. So if you're at that point where your back is screaming and it's on fire and you can't sit, you know, what you think for 1 more minute, and your mind is just doing nothing but concentrating on the pain, that's not the time to start these exercises. If you know you're going to be sitting for a long period of time, that's when you start these exercises, right when you sit down. And again, these are very 3 inconspicuous exercises. It's not really going to look like you're doing much of anything, but in reality, you're getting some blood flow. You're getting a stretch. It should feel good. Kind of a little disclaimer before we show you these: if they cause pain, if you wind up doing them and they send numbness and tingling down your leg, or all of a sudden you get a jolt, stop doing them, okay? Go consult a medical professional. These are not meant to cause pains. These should generally feel pretty good. All right, so the first one is just going to be a pelvic tilt. So Adrienne's going to show you in the chair, and you're not really even going to be able to see anything, because all she's going to do is just bring her pelvis forward, and then slouch back in the chair. So you're actually going to slouch, which is what you're always told not to do, but you're going to slouch back, and then you're going to rock your pelvis all the way forward and stick your butt all the way out. Okay? So as you see, Adrian's doing the exercise right now. You can't really tell. And a lot of times, the first couple times you do this, it's going to look maybe like a bigger movement because you're going to move your upper body. But once you get good at it, you can completely just move your pelvis. And all you're going to do is, again, slump down in the chair and then sit up and arch your back straight. Slump down. You can hold these for a period of a couple seconds so you're not, doing a huge movement, okay? But again, this is just going to start some of that gentle blood flow. This is something you start right away as you sit down. Just kind of tuck your tailbone under and then push it all the way back. Do that a couple times, 30 times, 40 times. There's no real sets for these because they aren't designed to be exercises that really, you're not holding them for an effective stretch, and you're not really doing them other than to get the blood moving, other than to get your body moving while you are confined to sitting. The next one's going to be kind of our figure 4 stretch, which is a great stretch. You should be doing this all day. Now, you may not be able to do the entire stretch because it may look a little bit odd, but this is what you can start with doing, is cross your ankle over your knee, all right? You might feel a stretch with that. You may not even be able to get your ankle up over your knee, which is a whole other issue, okay? That means there really is a significant problem going on. But bring it up as high as you can. A lot of people may feel a stretch right there, and that's totally fine. You can sit in a meeting, you can sit on a plane, you can sit on a train, just like this, okay? Hold it there for as long as you want. Let gravity do the work. Some people like to push this knee down. Fine. If you need to feel a greater stretch, you can push that knee down, okay? Just make sure that your butt stays down as you push that knee down. If you can get away with it, sit up nice and straight and then lean forward. You're going to get an even bigger stretch. This might draw a little bit more attention to yourself if you're not looking to do that, but this is a great way to get a nice stretch in through your back and your hip area. And you can sit like that. Even just sitting without moving, sitting without leaning forward, gravity is going to go to work on that knee, okay? So gravity is going to allow that hip to open up. So nice and easy. Then you're going to switch sides. You can do this throughout the entire meeting, okay? Throughout wherever you're at, or throughout your entire travels, okay? Just switch back nice and easy, back and forth, okay? You should feel a good stretch. Again, not pain, no shooting, no numbness, no tingling, just a nice gentle stretch. And the last one we're going to do is going to be just a hamstring stretch. Now, again, not the most effective hamstring stretch, but it's designed to do while you're sitting down. So while you're sitting there, all you're going to do is kick your heel forward. Now, the big thing with this is to make sure your heel hits the floor, not your toes, okay? Bring your heel up to touch the floor. Again, you're going to sit up nice and straight, and then you can lean forward. A lot of you may feel a stretch just putting your heel out in front of you as you're sitting, okay, and elongating that leg. This one may cause numbness and tingling or burning. Stop, all right? If that happens, you need to call someone. It's not 911 call, but you need to consult a medical professional when you have the ability to do so, because it does mean that there's an issue, a bigger issue going on. And then you can switch sides. And again, you can sit there for as long as you want, okay? Let gravity do its work. Lean forward at your hips. The one thing you don't want to do is slump forward with this one, okay? That is not okay. That's combining way too many things. But you're just really going to stretch your hamstrings. So sit up nice and straight and then hinge at your hips. You can go back and forth on that one. These you can do all throughout your travels, your meeting, your work day. They're designed to be gentle. They're designed not to be aggressive. They're designed to keep the gentle blood flowing, okay? Keep those muscles from spasming. Keep those muscles from hurting all the time.